Hey everyone, welcome to our fourth session from Fujifilm Irvine Scientific. Um, we will present today with a very interesting subject. So if you have any question, please use the chat part for any question or any comment. And yeah, don't hesitate to use the hand for if you would like to speak and share your experience or your opinion. Sorry. So, right. So we'll talk about today about the sperm cryopreservation, and it's really interesting to know that the attempt to try to perform this sperm freezing was very old. It was back to more than 200 years. And was there were many attempts to do the cryopreservation. So, for example, Dr. Lazzaro Spallanzani. So I'm sorry for the wrong spelling, but wrong pronunciation. That is an Italian doctor that he tried before to freeze sperm using the snow. So that was very interesting to know. And in 1953, it's been reported for the first pregnancy, human pregnancy, using short-term storage of semen using the dry ice. So it's been in trial for a long time. But with the liquid nitrogen introduced the ART by 1963, the cryopreservation and the long-term storage of semen or any other sample for the sperm, it became the routine thing in every lab. So today we will talk about the process itself, techniques, and we'll see how is that affecting the practice. So so what exactly we freeze in our lab? We have many reasons to freeze. And we freeze mainly, the main target for sperm sample freezing is really to manage the fertility or fertility preservation. Manage any treatment for the future use and also for fertility preservation. So we have many different samples and reasons to freeze, like the surgical sperm freeze, the surgical retrieved specimen, that we need to store these samples to avoid the future or repeated surgical procedure. We know that every surgical procedure is accompanied with a complication, so it's better to avoid that. So one of the reasons that we store this specimen for the future use. And also with ejaculatory and erectile dysfunction, like in a spinal cord injury and the retrograde ejaculation. So also with these cases, we can freeze the sample. With the risk also of decrease of the sperm parameters like oligospermia and the continuous decrease in the risk of azoospermia, that we can also freeze and these samples as a backup. Also, we have the donor sperm now is very common. Like we have the donor sperm banks, and that is providing us with different options for treatment. With also with some chronic diseases and like autoimmune diseases, the disease itself has some impact, and also the treatment has other impacts. So we store the sample and the sperm for future use as well. And the oncology and indication for that also, it's start to be widely spread all over the world. That is for fertility preservation, and even started to be also for young patients to fertility preservation. So this is because of the also cytotoxicity of the treatment, chemotherapy and radiotherapy. So this is what we is indicated for cryopreservation as well. The less common indication that is for the unavailable male partner, and this is, we do the freezing for avoid any convenience because of the failed ejaculation due to the semen collection stress and other certain emotional stress as well. So we, and it could be also other commitments. So with the absence of the partner, that would be difficult to go ahead with the oocyte retrieval and the treatment. The other reason that is also less common to use is the occupational risk. So some jobs actually expose men to might be hazardous material like radiation or toxicants material, and also the professional sport person, they can freeze their specimen for future family plan where they are more exposed to accidents or testicular injuries. So this is the indications that we use for when we start to think we need to freeze and we have backup and storage for the specimen for future treatment. How we do exactly the freezing? So we have a different techniques, and so we have a few techniques that is available, and but it's not all of them used in the same same common way. But with the most common is the rapid way. And so for the slow freezing, the first one, this is when we, it takes a longer time for freezing. It might be between 1 hour and more, like 2 hours. It can be, it happens like gradual decrease and drop of the temperature through like 2 to 3 steps. And we need to take the specimen from the room temperature, gradually drop the temperature by half to 1 centigrade per minute till we reach the 5 centigrade. And from 5 centigrade to minus 80, we need to take it for a slower drop between 1 and 10 centigrade per minute. And once we reach the minus 80, we plunge the specimen to the liquid nitrogen. This can happen manual or automatic. So there is a programmed machine that it can perform the freezing. And usually this machine takes from also the room temperature and controlling the drop of the temperature by 1.5 centigrade per minute, and then till 5 centigrade. And then after 5 centigrade, between 5 centigrade and minus 80, the most common rate is 6 centigrade per minute. And the machine has more control for the temperature drop. And after that, we store the specimen to the liquid nitrogen. The most common technique that is used these days is the rapid one. And it's faster than the slow method. So usually it takes the rate of the drop of the temperature from room temperature to 4 centigrade or 5 centigrade. It happens within 10 minutes. So from room temperature to 4 centigrade, that within 10 minutes. And then from 5 centigrade to minus 80, that using the liquid nitrogen vapor. So we use the vapor phase, and we allow with a distance between 15 to 20 centimeter distance from the surface of the liquid nitrogen to use the vapor phase. And that is within 15 minutes. And after 15 minutes, we plunge the specimen to the liquid nitrogen and store it. The less common technique, that is the vitrification. So sperm vitrification is not widely adopted in many places, and it's ultra rapid method, and it just take very it's very fast, and it doesn't take like really any time. But the difference is sometimes it doesn't need any equilibration with the cryoprotectant, because it might be using permeable cryoprotectant, or might not use. There is a cryoprotectant free vitrification, and they might use also the direct contact with the liquid nitrogen, or indirect contact. Although the vitrification, it did not prove that it has better results rather than the over the rapid method. But that is because if you apply it with the good specimen with a good number and motility, but it's being claimed that if you use it with low number and low volume of sample, that might make a difference. The last method and the technique is that is practiced is the freezing small number or low volume. So with this, there is different approaches to try to freeze small number of spermatozoa, or a very small volume, and the attempts been using biological or non-biological carriers. But again, there's no standard method for this technique, and there's no method or carrier demonstrated any superior results over other methods. So that, I guess, this is still in study. So this is the freezing techniques that we use. So how about when we would like to thaw that specimen? For the thawing, we need to reverse all the steps again, and we need to bring the cell back rehydrated to the normal biological activities, and try to avoid any like thermal or osmotic shock as possible. So we have the most common practice techniques for thawing is when we thaw in room, bring the specimen from liquid nitrogen to the room temperature for 10 minutes, and then put it in the 37 degree for another 10 minutes. Or thawing immediately from the liquid nitrogen, that is a more rapid thawing way. Just plunge it to 37 degree for 10 minutes. The last method that is, I guess, that is more commonly used these days is when we bring the specimen from the liquid nitrogen and leave it in the room temperature for 15 minutes till the whole volume is absolutely thawed, and there's no ice lumps can be noticed in the specimen. These methods is not one of the methods that we use to thaw the vitrified sample. So the vitrification sample, the vitrified one, they use a totally different technique for thawing a vitrified specimen, and it's been reported that they've been using immediately to 37 degree. And in one study, they said that they tend to use 42 degrees for a higher warming rate. So this is the freezing method, and this is the thawing methods that is practiced. But we see that these methods, despite they are useful, and we find the sperm and the motile sperm that is necessary for the treatment, but we can't avoid to mention that the cryopreservation in general, it has harmful effect and has a harmful effect on the sperm structure and function. And to see how is that effects happening, we need first to go through what is the sperm cell going through during the freezing, and to see how is that going to affect the structure and function of the sperm. So during the freezing, we know that sperm cell is a small cell with a large surface area, and that is theoretically should protect the cell in general during the freezing, because we have a larger surface for dehydration and rehydration. But in fact, this is not what's happening. There is few damages being observed during the freezing, and few events that is being reported. So one of these things that are happening during the freezing, the drop of the temperature might cause thermal shock for the cells. And because of the structure of the sperm is really high content of the phospholipid, there is a polyunsaturated fatty acids, protein, and carbs as well. So with this, the high content of the phospholipids is giving the characteristic fluidity of the membrane of the sperm. And during the freezing and the drop of the temperature, this fluid phase is changing gradually to a gel phase. So during these changes, there is a rearrangement of the phospholipids, and that is helping to, or causing some increase of the cell permeability. And with the continuous drop of the temperature, and with these changes does not happen simultaneously. So it happens in a different way. It's not in homogeneous way through over the membrane, and this is what causing the increase of the permeability. But with the start of the increase of the osmolarity of the extracellular fluid and drop of the temperature, started the extracellular fluid increase, and the gel phase is taking over. The permeability is really dropping to the point that the membrane start to be totally impermeable. And if the dehydration is not happening properly, any trapped fluid inside the cell that is vulnerable to causing any ice crystal formation. Because also we use the freeze media, this is one of the things that it's producing some kind of like osmotic changes. So the osmotic and toxic damage that might happen during the dehydration and using the cryoprotectant. One of the things also is being reported that the calcium influx towards the cell is being observed during the freezing. So it might happen also one of the, it's important to have a calcium balance during the freezing. So with these events, we see that is reflecting on the sperm cell when we see how is the injury being observed with the cell in the studies. So we see some changes and alteration on the cell membrane structure, and especially with the protein degeneration and phosphorylation. So that is affecting the sperm function later on. And also it's being observed that this is causing one of the acrosomal changes and capacitation-like changes as well. That's a capacitation-like action. And one of other acrosomal changes is acrosomal disintegration, and also the partial removal of the outer membrane of the acrosome. Other changes that we have seen for this in the cell, that the mitochondrial changes and the damage, and this is really affecting the energy production and the mitochondrial function, which reflects indeed on the sperm motility and viability. And with all this stress, that is also contributing to the ROS endogenous production. So the ROS is being shown that it's affecting the apoptosis of the cell. The abortive apoptosis with the oxidative stress is being shown that they are the main reason for the DNA damage associated with the freezing of the cryopreservation. So this is also reflecting on the post-thaw parameters that we see. So we see all this reflected on the motility and the kind of the motility. With the osmotic shock, and the might be also mechanical, that is changing the morphology of the cell, decrease of the viability and the survival. And this is with the during also the chromosomal changes and everything that is affecting the ability of the sperm for fertilization, and that is also being reflected on some embryo development on the ongoing process. So this is how is the process for freezing and thawing, and the technique in the lab. And this is to just show some cryo injuries that the cell exposed to during the process. But yet, when we practice these techniques, we always find the sperm, and we have enough sperm available for the practice. But I believe if we optimize everything, that we might get use these stored samples in more better way. So what exactly we can pay attention for? We know that the clinical results, it's so far is good that in some studies they reported like, yes, with the frozen sample is we can achieve also similar to the fresh samples. So it does not that much affecting, but in other studies they observed that yes, there's some other effects that we can see on the ongoing pregnancy and the embryo development. So the impact of the cryopreservation is not only for the specimen parameters only, it reflects on the treatment itself. So it's important to choose the proper technique and evaluate it. And also it's important to choose the cryopreservation media. So there is additives for every cryopreservation media that might help to support and prevent the damage that might happen during the cryopreservation. So it's important to see what exactly in my media that I'm using in the lab. So for every media, we always find the cryoprotectant. And that is, so the cryoprotectant, there is permeable ones and there is non-permeable one. You know, for example, just this is just an example for the permeable ones, like glycerol and DMSO and ethylene glycol. And we all know that the glycerol is the most common cryoprotectant used for to freeze the sperm. And also the non-permeable cryoprotectant, that is they playing important role in the media during the freezing. So we have like a glucose and sucrose, trilose, and raffinose. And these, we know that this is decreasing the freezing point, so it's important, and it might help also the sperm cryotolerance for drop of the temperature, and it stabilizes the lipid layer in the phospholipid layer in the membrane of the sperm, and might help also to reduce the osmotic shock. So that is the main component for the cryopreservation media. But there is also additives that it might help also to protect the sperm during the process. Like the buffer, we have to stabilize the pH, and that is very important. So we have different kinds of buffers that can be used. The antioxidant is very important, that they can be enzymatic antioxidants or non-enzymatic ones. Like the enzymatic, like the glutathione peroxidase, and the non-enzymatic one that is commonly used than the enzymatic one, like vitamin C and E and glutathione, and it's very important. The taurine and hypotaurin, that is being in many studies that is improving the results in the post-thaw samples. So they usually trying to prevent the effect of the ROS, oxidative stress, and radical Cavengers as well. Other extenders like the editor and straight, that they work as a calcium chelator, and we talk about the calcium balance in the it's important during the cryopreservation events. And also egg yolk was very common to use, and so far there's a lot of places they use the egg yolk media, and because of the phosphorate that is protecting the membrane as well, and or we can replace that also with the albumin and lectin. So these all are like a cell membrane and molecular, with the stabilizing the molecular structure of the membrane, the sperm cell membrane. So this is the common composition of any cryoprotectant media. So it's important always to go through what exactly I'm adding to my specimen. So it's going to affect your results. So it's worth to go in every composition and look at what exactly I'm adding to my sample. So finally, we need to look at a few things around the process itself. So every technique needs to be evaluated. So it's a different cooling rate and warming rate, and then it's need to be evaluated in every lab. And the way that we adding the cryoprotectant to the specimen, it's also important. So we need to appreciate the cryotolerance and the tolerance of the sperm cell membrane. So addition of the cryoprotectant should be slower. Although the sperm is a small cell and it has a lot of like large surface, but still the dehydration it might happen slower, and it needs also to you leave a proper time for equilibration between the cryoprotectant and the sperm cell. The pre-freeze parameters is also give you an expectation and prognosis for the post-thaw. Although with every specimen that is frozen, it's recommended and it's good to perform, if possible, the post-thaw test. So you need to test your specimen before you store it, and you decide, like, I'm gonna long store this sample and leave it for the later on use. So the also we need to consider like some composition in the media and some techniques, they helping to eliminate the ROS generation. So the ROS has a really adverse effect on the sperm cell and the function. So it's good to evaluate the technique and the media, whether they it's helping to eliminate the ROS production or not. So we usually use the total sperm count and the viability as a parameters to assess the success of the process. But there were a few studies that are trying to find out if we can use different biomarkers and parameters to evaluate the success of this method. And I believe in the future we need to use different biomarkers or molecular indicators for showing how is the process is actually successful or not. So thank you very much for your attention, and if you have any question, just let me know. Thank you. Somebody saying that it's a good presentation. Thank you. I believe that we need to give more attention to the sperm, because we give a lot of attention to the oocytes and the embryos in the lab, but sometimes we ignore the male factor or the male part. So I believe that we need to really give good attention to that. Right. So thank you very much for your attention and listening. If you have later on, you come with any question that you can really send it, and we're happy to answer this. Right. So thank you very much.